We found it in the heart, although our animals were exposed in the whole body condition. So the fact that this tumor type was the same is the thing that really drew our eye to it. And also, there were some of the strongest findings from a numerical standpoint, the incidence of the tumors that we found in our animals.
What would you warn people, and is there a panic about phone use?
I don't think there's a panic about phone use. First of all, our studies are what are called hazard identification studies. So these studies are done under conditions that in essence provide what would be considered an extreme exposure scenario to animals to reveal the potential for biological changes. What was it? The main question?
What should just the general public take away from this?
So there are a number of ways that one can use your phone that removes or diminishes quite a bit the radiofrequency radiation that you receive when you're holding the phone against your head. First of all, you can reduce the radiofrequency radiation considerably by simply holding the phone slightly away from your head, which is what is recommended by in the phone insert. When you buy a phone, you can read the insert, and there's a recommended distance that you keep the phone away from your ear. Otherwise, you can use earbuds. You can use just holding your phone away from your body is the best way to reduce radiofrequency exposure.
And what about
radiofrequency exposure? Well, that's a good question, and it's really a good idea to not put your phone in your pocket, not put your phone next to your body. Leave a distance between the phone and your body. So there are a number of ways of reducing exposure. And of course, using the phone only for making calls instead of just having it on all the time.
John?
Yeah, so I just want to make sure I understand the votes. They voted that there is clear evidence of heart tumors in male rats, which previously was some evidence. But they also voted some evidence where it was equivocal, and that was for males and females for brain tumors. Right. So now that we have this, says clear evidence for heart tumors, is it heart tumors or lesions?
These are lesions of the nerve sheath around nerves in the heart.
So it's cancerous growth?
It's a cancerous growth of the nerve sheath, in essence.
Okay. And so what happens next? These are recommendations by a panel, right? So this is taken up. Tell us what happens next, and when does this become final? Who makes the final decision?
Well, first of all, we need to revise our reports. There were a number of recommendations that were made by the panel. We will review these panel findings, the recommendations. We will revise the report. We will submit the report to our director for her consideration to accept or reject the recommendations of the advisory panel, this is what this was an advisory panel to the director. Once the director accepts or rejects the advice, the report will be completed. The report will then be released.
And what are the implications for policy? For instance, the FCC has a standard of exposure standard of 1.6 watts per kilogram. I don't understand what that means, but first of all, tell us what that means, and then what are the implications for that standard based on this study?
So that's what's called a localized standard. So what it is 1.6 watts per kilogram is a permitted upper level of exposure to a small piece of tissue, either 1 gram or 10 grams, basically. So it's an allowable amount of radiation that will not heat that one small segment of tissue more than 1 degree centigrade during the use of
So that's
the
a
phone.
thermal standard.
It's a thermal standard.
Does your study imply that other standards are necessary that are non-thermal?
Perhaps.
Can
That is
you
a
explain that?
recommendation. That will be a consideration of both the Food and Drug Administration, who has jurisdiction over the running basically the risk assessment of potential biological effects of radiofrequency radiation, and it will also be then considered by the Food Federal Communications Commission.
What do we
FCC.
call a non-thermal standard?
Well, I don't think we have one at the moment, so it would be a biologically based standard rather than a thermal based.
Could it result in a warning on a phone, like on a cigarette label or something like that? Or would the phone industry then change their technology?
I can't really address that. It's really out of the.
Because some of the activists are saying they would like to see changes in technology, warnings, and things like that.
It's really out of the realm of my.
Right. It's in the hands of these other health agencies,
Yes.
how they address this, and in the hands of the technology industry.
Yes.
But you expect something will be done with these findings that are serious enough that they cannot be ignored?
I think that we need to go through these findings. Again, one of the most difficult things is understanding the relative exposures. Translating the exposures that we did to the whole bodies of these animals in a reverberation chamber situation, and relating that type of an exposure to holding a phone against one's head. And there's lots of considerations that have to be.
Or having it on your hip or in your
having
pocket
on
for hours at a
your
time?
pocket. There's a lot of considerations that are not taken into account during the course of this meeting in the translation of this information into that standard.
Let me ask you this. Could the cell phone industry, whatever they're called, CTIA, I believe their main group, could they challenge this study legally or in some other way where they would ask it to be reopened, or would they try to have it revised? Do they have any, or is the study closed essentially?
There is no, this is an independent hazard identification study that will be published, and there is no way that the findings are the findings.
Right. But they would presumably they would change the debate because they elevate the level of risk, at least in animals. Right. So we would expect to see
Well,
that
we're
this
not talking about risk to animals, but yes, it would raise the level of debate, yes.
Okay.
Depending on the translation of this information to the human situation. And that's an important translation that has to take place. That's the next step.
And that's the job, I guess, of the public health agencies to assess that. And I believe that's where the technology industry, the telecom industry would get involved in expressing its issues to those industries and telling them why, how to interpret this data correctly.
Could well happen.
All right. Thank you very much.
Thank you.
All right.